Hi everyone. I recently had shoulder surgery and I'm going to create a series of videos to take you through how I'm going to do my rehab. Hopefully this will help you if you're about to have shoulder surgery or have had shoulder surgery and are not sure what to do. All right, so why did I have shoulder surgery? Well, I was doing some trail running and I was coming downhill and tripped on a rock and fell onto some other rocks and knew immediately something was wrong. And I waited about 2 or 3 months to see if that would heal. I was trying all sorts of different exercises and so forth to help my shoulder, and it just wasn't feeling right. And so I finally went into an orthopedic surgeon, did an MRI, and I had a slap tear, and which is a labral tear in the upper part of my labrum. And the labrum is the thing that deepens the shoulder socket. So we have our bony socket, and then we have a labrum that surrounds it that helps hold that arm bone in there. And the biceps tendon inserts into that, and so all of that was disrupted. So here's a picture of frayed labrum, and you can see the little wispy parts of the labrum there. And then also here are some pictures of some pieces of cartilage and bone floating in the shoulder joint. And so you can see that they're pretty big. He took a picture of one right on his tool, so you could get a sense of the size of all those chunks. He said there were probably about 5 or 6 of those chunks floating around in there too. And then he also cleaned up my acromion, which is the bony roof of your shoulder here. It was a little thick and impinging on my rotator cuff a little bit, so he went in there and scraped that down and cleaned that up as well. What he ended up doing was, it's called a biceps tenodesis, which means that he just basically took my biceps tendon off of the shoulder insertion in the labrum and put it on my arm bone instead. So here's a picture of how he tied that down and is now inserted on my arm bone. I'm going to ask you to please subscribe, like, and share this video if you find this information helpful for you, because that way you can help other people too. Thank you. Before I even had the surgery, I asked him for the rehab protocol because I wanted to see what was expected during the first few weeks and so on and so forth. Basically, I'm going to be in this sling for about 5 weeks, and then in that amount of time, this biceps tenodesis should be healed down. Now, I won't be able to do, 30-pound dumbbell curls immediately, but I'll have to work up to that. But during this 5 weeks with a biceps tenodesis, you don't want to really stress the biceps tendon because you don't want to pull those little sutures loose. And so I'm being a very good patient, and I'm not doing that. Because he didn't repair the labrum, in fact, he just shaved it off, that allows me to be a little bit more worry-free about pursuing shoulder range of motion exercises aside from the biceps tenodesis. And so today what I'm going to do is show you 3 exercises that I've been doing to improve my shoulder range of motion. So first of all, what I wanted to show you was I have his rehab protocol here. And weeks 0 to 3, he calls it the protective phase, and our range of motion goals are forward flexion. He wants that to be protected but go to 90 degrees. And then internal rotation is protected to 65 degrees. Well, I mean, if you look at this sling angle, I'm easily at 65 degrees just in the sling, so internal range of motion is no problem. And then external rotation, which is the opposite. External rotation means the arm moving away from you, is up to 30 degrees. So, and I've got that for sure. So he would like me just to do passive range of motion exercises, pendulums, shoulder pendulums, and I'll show you what those are. He doesn't want any biceps contraction at all during these 0 to 3 weeks period, and maybe begin with submaximal rotator cuff isometrics and things like that. So I'll show you what I've been doing. I haven't really, only today, which is the last day of the 3 weeks, did I start doing a strengthening exercise, and mostly it's because of the shoulder has just been very tender during these 3 weeks because of all of the work that he did in there. And so, I'm not too worried about my strength because none of my rotator cuff muscles were torn. He didn't repair any of that, so I'm not worried about losing that strength. So I didn't see that as high as a priority as gaining my range of motion back. And these first 0 to 3 weeks is really important because if you don't work with your range of motion, there may be a chance of frozen shoulder, which is basically where the whole fascia around the shoulder and the shoulder joint capsule shrinks, and it makes it nearly impossible to move your shoulder. And especially when your arm is in a splint like this with internal rotation and there's no flexion and all that kind of stuff, then there's a chance that frozen shoulder can occur. The verdict is out on the etiology of frozen shoulder. No one knows why it happens, but I just wanted to make sure that wasn't going to happen with me. So within probably on day 4, I started taking my arm out of the sling and starting to do pendulum exercises. And I was just very gentle with it, and you can see with the angle that I'm showing you even here that I'm able to get almost to 90 degrees of shoulder flexion just doing a pendulum exercise. And frankly, that was good enough for me in the time being because I was still quite tender at that point. Now, a couple interesting things. I think if you're about to have shoulder surgery, I strongly recommend that you invest in a few short sleeve button-up shirts like what I'm wearing here, because you won't be able to get t-shirts on, and long sleeves is just too long to get your arm through. So short sleeve shirts are very helpful. Now, for the first couple weeks, there was gauze and padding on the shoulder, which made it really difficult to get my short sleeve shirt on. I went to Goodwill and I got a couple of nice short sleeve shirts that are a size bigger than what I normally use. And that allowed me the freedom to get my arm in and out of that shirt easily without tweaking my shoulder. And also, when you put on these shirts, you usually put your bad arm in first, get that up there, and then to try and get your arm around into a shirt that is your correct size takes a little bit of wiggling, and it tweaked my shoulder quite a bit. So getting a size bigger really gave me the freedom to just not strain or stress to get that shirt on. And it was a much nicer experience once I got larger shirts to get into. So that would be one of my recommendations. I think another interesting thing is that they used a spinal block during the surgery. And when I came home, I had no feeling at all in my arm and hand. And so it was floppy. I had no motor control. It was just like a limp arm there. Of course, no one prepared me for that. They just said I was going to have a spinal block and that would wear off soon after the surgery, but it was a good 12 hours before that started to wear off. And I was getting a little concerned, but I'm just like, okay, just chill out. So I woke up the next morning and I started feeling some sensation in my hand. I thought, okay, it's starting to wear off, and I could just barely move my fingers. But during that period of time, I had no awareness of my hand. And so it would periodically, I would bump it or, run into a wall with it or something like that if I was turning. And I'm just like, what was that? And then I looked down and it was my hand. So, be prepared that may be what's happening with you immediately after that surgery for the first 12 to 24 hours is that if you had a spinal block, you may have, a really floppy arm and not be aware of it. And you may be prone to bumping into it. I think the other thing that I would say is, I've counseled patients a lot prior to surgery to have like a lazy boy chair or something like that to sit up in when you're sleeping. And I think that definitely would have helped me that first week and a half. I didn't get a lazy boy chair. I just tried to sleep up in my bed. One of the keys that I found with sleeping in bed with something like this happening is when you're on your back, let's say I'm on my back here, put a pillow beside your body here so that this elbow is resting above the level of your back. So my shoulder felt a lot better when it was elevated up a little bit. That took a lot of pressure off of the shoulder joint. So there's a little tip for sleeping for you. And then when I was sitting at the table or sitting watching TV or something, the weight of the arm, that's a good, 10 to 15 pounds of weight that you're just resting on this sling. And what happens is it digs into your upper trap up here and it gets kind of really achy up there. So whenever you sit down, what I recommend is getting something firm that you can put underneath that to take the weight of this sling off of this shoulder here. especially if you're prone to shoulder, neck pain, things like that. This sling digging into the shoulder became quite painful. That was necessary for the first week and a half to 2 weeks. Oh, and then the other interesting thing was when I was taking oxycodone, and for the first 2 nights after surgery, I couldn't sleep. The oxycodone, for some reason, was making me wide awake. I was wired. I just couldn't sleep. And so finally, after 2 nights, I went off the oxycodone and just took acetaminophen. And I was fine with that because after that, about 3 days, the more severe pain kind of calmed down, and I was just left with light ache that acetaminophen could take. So I got off that oxycodone quickly after that surgery, mostly because I just couldn't sleep, and I didn't want my mental status to be affected, or I didn't want to get cranky, all that kind of stuff. So other than that, those are the tips that I would give you, pre and post surgery. So let's get into the 3 exercises I've been doing to help my range of motion. And the doctor checked my range of motion after 2 weeks. It was beyond excellent. So hopefully these exercises will help you. Now, the first exercise will be what I call all fours rocking, and this is to improve shoulder flexion range of motion like this. And the goal is 90 degrees. And what I have found as a therapist is that it is much easier to move the body away from the arm rather than moving the arm away from the body. So if you have pulleys or things like that and you're trying to pull that arm up and it's very painful, in fact, even now I still can't do a pulley exercise. It's just too painful in the shoulder. But doing how I'm going to show you this all fours rocking exercise is virtually pain-free. It's just stiff in the shoulder. That's the only thing that's preventing me from going any further. So I think this is a much better way of getting shoulder flexion range of motion. Then I also want to make sure that you understand that I am not weight bearing through the arm that that's on the ground there. So all of my weight is on my legs and on my other hand, and this arm, the surgery arm that is on the ground, is not weight bearing at all. And the other thing I want to mention, a little tip with that, is I usually do this at the edge of a carpet. We have throw rugs in our house. And so I just clip my fingertip on the edge of that throw rug, and that allows me to anchor that hand more easily. Because I'm not weight bearing, it's hard to keep that hand stable and not sliding around on the floor. But if I can just very lightly grip the edge of that carpet, that allows me to anchor the hand so I can move my body away from the arm. So this is what it looks like. All I'm doing is starting out on my hands and knees, and I'm rocking back onto my heels just as far as I'm going. And what I've learned is that, the first rock is very short and it's just getting the shoulder warmed up. And as I stay there longer and longer, I can go further and further. And I just made sure, I don't need to be a hero about this. I just made sure my range of motion was doing okay. I'm not trying to set any records. I'm just trying to use whatever range of motion my shoulder seems to want to give me. I'm not pushing it at all. I would spend, the first day I would spend maybe 15 to 30 seconds on that. I wouldn't linger there at all because I didn't want to irritate all the surgery that had happened in there. And as time has gone on, I've been able to tolerate more and more time there and been able to go back further and further towards my heels to get that range of motion. The next exercise is for external rotation. And for that, what I did is I basically held my hand against a dining room table or a kitchen countertop, and I faced the table. So now at this angle, I am at 0 degrees of external rotation, all right? And then all I simply did was turn my body away from my hand and open it up to get more external rotation. And this worked really well. It allowed me, I think, to progress my external range of motion much more quickly than if I had tried to use a band or some other thing to move the arm away from the body. Right now, I can easily turn my body 90 degrees away from my hand, and I think my external rotation is excellent at this point, which is one of the hardest ranges of motion to get back after these types of surgeries is external rotation. So this is one I focus on because it is so hard and tricky for a lot of patients. I wanted to make sure I wasn't one of those patients that is stuck, with needing to get more external rotation. The first time I did it, I may have opened up 5 or 10 degrees. And after a few days, I was able to get to maybe 30 degrees. And then as this old surgical site calmed down, I was able to go further and further. And now I'm, at 90 degrees of external rotation in this position. It may be different once I bend my arm and try and open it up like this. But for now, I'm very content with that. I feel like it's stretching tissues in the front here gently, and it's not straining anything. The last exercise is not on the doctor's range of motion goals, but it was a goal of mine again, or I was worried about frozen shoulder. I wanted to make sure I started getting some shoulder abduction. Shoulder abduction is when the arm comes away from your body like this, and usually the arm is out to the side, something like this. So again, using this principle of getting the body to move away from the hand instead of moving the hand away from the body, I just put my hand on a bar stool in our kitchen and I just knelt down to the ground. First, I knelt down so that I was in flexion. And then what I would do is I would then open my body into external rotation and abduction like this. And now I can have full abduction away from my body. And at this point, and in anticipation of meeting those goals, today I've started doing some strengthening, which I'll go over in the next video. I hope this helps frame how to look at those first 0 to 3 weeks. It's definitely not a time that you want to just be idle, because we have to make sure that that shoulder does not become frozen, and we really need to get our arm out of the sling to improve our range of motion and get that back as quickly as possible. That was the doctor's primary concern on my 2-week visit, is that I didn't show any signs of frozen shoulder going on. So I feel very fortunate. I'm very happy with how things are progressing. I'm being patient. I don't feel like I'm pushing things aggressively at all. I'm just taking whatever my body is giving me, given my knowledge of the type of surgery that I've just undergone. I hope that helps, and I'll see you on the next video.